Hello, everyone, and welcome to Arthritis Talks Medical Cannabis 101. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society. Every day, our team fields many questions from people across Canada who are curious about medical cannabis and how it might be able to provide some relief from their arthritis pain. There is a significant amount of information out there, but a lot of it can be confusing. So that's what brings us here today. Today, we are joined by family physician and medical cannabis expert, Dr. Shelley Turner, who will answer some of the most common questions that we receive about medical cannabis. Before we get started, as usual, a few logistics. This webinar is best viewed on a laptop or desktop computer. If you have technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you could submit it through the Q&A button at the bottom middle of the screen, and we will try to get through as many questions as possible in the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants and the Arthritis Society's chat moderator. If you'd like to close that chat completely, just click that red X icon to close out of the window. We're also pleased to provide captioning of our webinars to accommodate the diverse needs of our audience, and you'll see that running along the bottom of the page. Many of the questions that we received followed similar themes, so we will address those first before going into the live Q&A at the end of the session. Before we get started, I want to take a moment to thank our event partners, our exclusive event presenting partners, Canna Farms and Harvest Medical, who you will have the opportunity to speak with at their virtual information booth following this webinar. In addition to the support of Canna Farms and Harvest Medical, we are also grateful to Pfizer, United Way Winnipeg, and other partners for their financial support of our Arthritis Talk series. So with that, let's get started. First, a warm welcome to Dr. Shelley Turner, who is joining us from Manitoba. Dr. Turner, there is so much information out there about cannabis, and it can really just be overwhelming. So could you just start by explaining what is medical cannabis? Is it safe? Is it not? Get the conversation started.
For sure. Hi, everyone. Thanks, Sean, Dr. Bevan, and to the team at the Arthritis Society for the invite to have a very quick conversation about medical cannabis 101. So big questions that we always have, obviously, in and around safety, and there's so many things that we could address as it relates to that. But really what we need to have a conversation about really is what is medical cannabis. So medical cannabis is really about how our intention of use, how we use it, how we access it, how we obtain our knowledge, really, and risk versus benefit. When we talk about safety, we always think, up in the clouds where people make all the rules. So that's generally our provincial and our federal regulations. So as you know, with provincial regulations in and around adult use, which is your very prominent and local dispensaries that are available to people. But again, those are just for recreational venues. I'm sorry, my clicker has just died on me here, guys. If you could push forward, please. And as I was alluding to with the federal regulations under the Cannabis Act, medical cannabis patients access through here, and that is through an online portal. It's being assessed by a physician, and a medical document is created and sent to an online portal for the patient to order. Very challenging in terms of access, but we hope there will be changes. Go forward, please. So again, this is just talking a little bit more about the federal regulations and what's entitled with that. So mostly patients are allowed to grow medical cannabis for themselves and carry more than 30 grams per day. Forward, please. So again, this is just in terms of the medical documentation. So medical cannabis, you're accessing through the legal portal with a medical document or prescription. And that is provided by your healthcare provider. Hopefully it's your family doctor, but most patients are receiving their documents from either a specialist, medical cannabis specialist, or a nurse practitioner. Forward, please. So safety again, is it safe? Well, medical cannabis, when we're dosing patients appropriately, there's very limited intoxication, if any. For the most part, driving and safety considerations are in and around cognition and the ability to function normally. Most patients, when they're taking something that is of an intoxicating nature, which can be THC, generally there's very clear guidelines on how to when you can drive. So if you have been intoxicated, no driving for up to 8 hours, particularly if you're ingesting. If you're inhaling, again, as you can see, the parameters in terms of your ability to drive are really related around intoxication. So most patients that are using medical cannabis for medical purposes, even around inhalation, most are able to manage on lower doses and most are not intoxicated. So, and these are really big concerns for patients as it relates to tolerance. And, you know, how are we determining intoxication at roadside testing? So that's the other concern for medical cannabis patients. But again, this is really about intoxication. Next slide, please. So this gets a little bit into my territory in terms of assessing risk. So the work that I do is primarily around substance use, addiction, and mental health. So patients are referred to me primarily to reduce opiates, to reduce benzodiazepines, particularly if they're having challenges with sleep. And so we're always kind of looking at the whole continuum of medications that we prescribe or that patients are on. So looking at addiction rates. Again, patients come to me for worries about being addicted to cannabis. And when we look at the broad spectrum, alcohol, tobacco, opiates, the risk is low. It's still there, but that comes with the ability to assess patients. And so that's done quite thoroughly when we do our assessments. Next slide, please.
So thank you for that insight. Could you speak a little bit, Dr. Turner, about the research specifically around arthritis and medical cannabis? What do we do? What do we actually know?
So there's a ton of information out there as it relates to prospective, observational, particularly Renslow and Greece actually just released a paper 2022 as it relates to patients that have orthopedic issues and using cannabis. And what we showed there, I kind of call it the paper of thirds. A third of the patients were already trying it. A fifth of the patients actually had challenges with dosing. A third of them thought that this medication was the be-all end-all, and so it had great improvements. And if you could just go to the next slide here, I'll move on to this one here too. But what we find in this population of patients is that there is a great interest, but very minimal education on the part of the prescribing patients. Less than, I think it's 30 to 40% of physicians or healthcare providers are receiving education on endocannabinoid system and even how to prescribe. So when we look at populations of people that are using medical cannabis from an observational perspective, absolutely. And in this particular, and this again is not specific to dosing or mechanism of action, but I think most patients that are living with arthritis and can relate to the thumb joint arthritis and how it interferes, a lot of the issues around this was preconceived notions and ideas about cannabis, and education around that was lacking. If you could just move to the next slide, please. And so there was this preconceived notion in just over 200 participants, this preconceived notion that they were going to become addicted. They were very nervous about that. They would have preferred to speak to a physician regarding their dose, but they were accessing it through dispensary. And this was down in Virginia, actually. So they had a very difficult time trying to navigate the system. And when patients were using this, they didn't really have an idea about how much they were using. They were accessing it, but they didn't have, they said it worked for them, but they weren't really sure on the dose. So that's, again, another red flag, particularly when you look at the comorbidities that the patients were living with, primarily around kidney disease, heart disease, and other medications that could interfere with their cannabis medication. You could just go to the next slide, please. So again, coming back to the whole concept of chronic non-cancer pain, very broadly, this was a review. 2,000 patients sorry, 2,000, an N of 2,000, and really looking at the improvement of brief pain inventory, and very broadly, sleep and anxiety, which I'm going to just show you on the next slide. Pardon me, sorry, it's the RA slide. So as it relates to rheumatoid arthritis, as we know, with arthritis, we have our patients living with inflammatory arthritis, definite benefit as it relates to quality of life indicators, as well as their brief pain inventory scores, which showed definitely that there was improvement. The other piece around this was the ability to deprescribe medications. So many of these patients are on a laundry list, which may or may not include opiates, other sleeping medications, over-the-counter medications, NSAIDs, and then other medications, and so that they're even taking for mood. So we really noticed a big change in the ability to deprescribe from those medications. Sorry, the next slide, please.
So another popular topic that we get asked about really is just, is it right for me? So how do you know whether or not you are recommending medical cannabis for one of your patients?
Right, you could just move to the next slide, please. Yeah, I think it's really about the assessment. So at AOSA Health, we really, and this is a beautiful slide from Dr. McCallum. So Carolyn McCallum is the premier researcher in medical cannabis here in Canada. And she's great at pulling all together what we see in clinical practice and what the steps should be. So really a thorough assessment from a stepwise approach. So for my practice, again, really focused on the chronic non-cancer pain and substance use. So we're really looking at a very broad history there, but we're also looking at sleep scores. So I always say the patient voice is so important, to be able to turn the patient voice into a number so that we can measure and show that what we're doing is actually working, or if we need to adjust or find other findings. So we're looking at generally sleep, all the mood scores. So for depression, Pittsburgh Sleep Index, brief pain inventory, all of those, and function. So again, very broad assessment, I think, is hugely important, because in the next slide, please. What we're really worrying about is, are there going to be drug interactions? And I know that this is a big concern for many patients out there. I'm on a certain amount of medications. What may interact or not if I'm considering medical cannabis? Next slide, please. So again, just kind of coming back to the safety piece where, and I'm sorry, I can't really read this very well, but this is really looking at precautions and contraindications again. So, age, we generally, again, it says 25 and under. Well, most patients that are being prescribed cannabis that are 25 and under are not being prescribed large doses of THC, generally prescribing large doses of CBD. Generally with patients that are living with heart disease, particularly around arrhythmia, or patients that are using blood thinners, we're kind of cautious with that as well. Certain patients with obviously respiratory issues or mental health challenges, primarily around psychosis, and bipolar disorder, we're really very cautious about dosing. Does it mean that I won't prescribe to them? No, it just means that we need to be very cautious and monitor very closely. Next slide, please. So a busy slide. Potential drug-drug interactions, and I really wanted this to look busy like it is because the complexity as humans, because the drugs that we take, we have a pretty good idea of how they work in our body. With cannabis, I think we have a pretty good idea to a certain extent, but we're always worried about it are the interactions. And so a few things that I know that people are worried about in terms of biologics. We don't think CBD would have much of an interaction, but we're always looking at how we monitor that. So with patients, so as it relates to flares, I have a number of patients that will start cannabis and be on a biologic and decide that they're feeling really well and managing and will decide to take a holiday. Well, that's a conversation for your rheumatologist because they feel so well, but understand that that's not for everybody. Not everybody has a unicorn reaction to cannabis. The other issues, again, are in and around medications like SSRIs, so people taking medications for anxiety. People start to feel well and they immediately want to come off their medication. What I say is there definitely may be a benefit. We don't want patients to be increasing their CBD because, again, that could be working within the same framework as your SSRIs for anxiety. So we want to just make sure that people are being monitored closely because we don't want people to either have a big reaction, either a big negative reaction to their SSRI or to cannabis. And then, of course, again, as I talked about with blood thinners, what we worry about with that primarily is that competition. Theoretically, will it make the medication be stronger or will it actually make the medication not work at all? And what I'm talking about is warfarin, one of the medications that we can monitor very closely. We do that regularly for patients. So if any patients are out there on warfarin and they're initiating medical cannabis, that should be a conversation with whoever is monitoring their INR or their warfarin therapy, so that they can actually have test their INR more frequently to determine whether or not that's going to be an issue. And then again, with certain medications, we always think about, do I take my cannabis at the same time as taking a medication? And so for some of those medications like statins, so for cholesterol, we always say, if you can give it some time, generally you should be taking your statin at night. If you're taking any of your cannabis, try and take it in the morning. And then as it relates to root, various routes, and again, with the changes in the cannabis access and product, we can ingest cannabis, we can apply it topically, we can inhale it. And again, other mechanisms are actually suppositories, which are very exciting for many patients that don't want to have that first pass through liver. Really excited by those. Most patients that I'm prescribing to are using ingestibles. So that, again, would be oils, capsules. Most patients aren't inhaling, but if they are, they're using the 510 vape carts, the threads, which I believe is a harm reduction versus inhaling cannabis combusted versus vaporization. Next slide, please.
So I wanted to shift gears a little bit and talk more about dosage. So for you as a physician, how do you start to put somebody on medical cannabis? And then how does a patient know that they're actually being dosed properly?
I think that's a great question. It's always a question that patients ask back to me. How will I know this is working? And really the patient, I always say you're driving your own bus. So the reason the patient comes to me generally when we talk about arthritis is pain and sleep. So with dosing, generally I start patients on the same, depending on how the patient is feeling. I generally will start them on CBD initially. The dosing is very broad, 2.5 milligrams to 20 milligrams per kilo per day. So if you're a 50 kilo person, targeting that dose to a maximum of 1,000 milligrams a day of CBD, which again is very unobtainable for most of us that can't afford 1,000 milligrams a day of CBD. So the CBD dosing would be started generally in a twice or 3 times a day dosing. For some patients, once a day dosing may be beneficial if they get to that point of diminishing returns. When we talk about adding in THC, again, it's different for patients. So some of the questions I ask patients are, how sensitive are you to other medications? How do you react to other medications? Because anybody that's out there will say, oh man, I'm really sensitive. So I'm generally very cautious about how low I start a THC dose. If patients say, man, you could hit me over the head with a cast iron frying pan and I won't feel it. And I've had those patients. I have a lady in her 80s that took 100 milligrams of THC, didn't blink an eye. Why is that? Well, we're going to get to that. But THC dosing, generally, I'm very conservative, 1 to 2.5 milligrams every 8 hours as needed. And then for those of us and our patients that are having challenges with sleep, I use generally what we've found in our data, which I'll come to, is a 1-to-1 formulation generally is the best method for our patients because it gives us a little breaks with the CBD. So they get THC and CBD. CBD again using kind of from an anti-inflammatory perspective and adding that in. So generally starting those patients on 1 to 2 milligrams of THC and CBD about an hour before bed, and then increasing that dose to effect. So how do we know it's working? From the patient's perspective, they're going to be sleeping better, hopefully less pain. From my perspective, when I'm assessing those patients, so in some of the studies that we talk about, assessing at 3, 6, and 12 months, my patients I'm checking in with at a month, I see them at 3, at 6 as well. And we're doing asking all those questions: anxiety, depression, sleep, your function, and your pain. So, and I'm generally very pleased with progress that the patients are having. The challenging folks and the ones that we really want to have a little bit more conversation about research are the ones that medication doesn't work as well, or the patients that are very sensitive. So there, I think I talked all over those slides.
I think so too.
Yeah.
That's great, Dr. Turner. So another area of concern for people is certainly related to side effects. So could you just touch on those and what really should people be most concerned about?
Could I just get you to move to the next slide? So what I see in my practice for the most part is diarrhea in patients. That's significant that we have to change the dose, and it's primarily around CBD. So it could either be the oil or it could be the cannabis. And so that's always a very interesting thing. Dry mouth, people that are very sensitive to THC, you'll find that they'll be quite nauseated, they'll have a headache, they'll feel really hungover. So those are some of the things that I'll see in my practice. But for the most part, I find this is probably one of the most tolerable medications. I have more patients coming in for side effects as it relates to other medications that we use to treat anxiety and depression, a litany of side effects. The other thing that I just want to point out with cannabis is and I think it was in the slide there, it's one of those medications that generally we're kind of a one pill focused people, right? We go to the doctor, we get a pill for this. Cannabis is a very broad, it's like a very big roller brush that we're kind of tacking on to a whole bunch of things. So it's very unique in that way. And so in that, to have a very low side effect profile and to be able to manage a number of things, I think is very exciting.
So you've touched on this already, but could you elaborate a bit more about what impact medical cannabis has on people's sleep and what are your thoughts about it?
Sure, if you could just go to the next slide, please. So this is just kind of talking about that broad stroke. So patients will come to me primarily, again, as I say, the issue is sleep or the issue is pain. It is generally multifaceted, particularly our patients living with pain. So what I see in my practice is that patients that initiate medical cannabis have great improvement. And I'll be excited to show you some of our research as we start to be able to process it and get it out to the public. But what I see in my practice is that initiation, particularly around brief pain inventory, so your pain severity and your pain interference scores, pain severity drops significantly, I would say by about 20%. But where you see the big changes is in the interference. So a good pattern there. Like you're thinking, oh boy, that pain severity would be dropping like a rock, but it's actually the interference. So what I call cannabis is the great distractor. It's distracting for people. It's providing that ability to focus on other things. And then when we talk about mood, so patients are able to focus on other things. So us doctors that are cracking the whip and asking our patients to move their bodies more, they're more apt to do that. And what does that do? It lifts mood. So I think a more focused cannabis prescription, which I always include yoga and exercise, makes a huge difference for patients. So I'm very pleased with the progress that they have.
Thank you so much for all of that. Before we get into the Q&A from the live audience, do you have any final thoughts or recommendations for our viewers?
Sure. Would you mind going to the next slide, please? So I always love to show this slide. Recommendations really are to use your voice. We need more research. This lady here is a very interesting lady. Her name is Jo Cameron, and there's a Canadian connection to this. One of the authors on here, they're talking about genetics. And so I kind of alluded to this lady that you could have hit her over the head with a cast iron frying pan and nothing really worked for her. Well, this is Jo Cameron, and she has THC in her body that she just makes so much of it that she doesn't require any analgesic to have surgery. She's a very happy lady. And so why is that? Well, she's got some microdeletion in her endocannabinoid system. So people like Jo Cameron are very interesting to us. And so there's hope for patients living with arthritis and chronic non-cancer pain, so that we have another tool in our belt, hopefully in the very near future. If you go to the next slide, please. And again, data. So all of us, Harvest, Cannafarms, everybody out there that's working in the space to collect data from our patients. Our patients are the voice of what we do, and really the glue that keeps us all together so that we can continue and move this very important research forward. And if I could get you just to go to the next slide. So genetics are hugely important. Partnerships are really important. So we encourage people out there to be participating in research with, if I'm not prescribing your cannabis, please find somebody that will do that and be participating in research. I just wanted to show, focus on one little document here, one little graphic here is Cerebra. Cerebra is a sleep technology company, and one of the things that we talked about today was insomnia as it relates to our patients living with arthritis. And so we're embarking on an observational study with testing their state-of-the-art sleep gear with patients using medical cannabis, and we will be undertaking our recruitment in the next month or so. So research is key. And for patients, sorry, just next slide, please, is remembering that when you're starting medical cannabis is always remember to start your dose low. If you are I would hope that you would try and find a prescriber to access medically, because the people in dispensary aren't allowed to give you medical advice. So try and find a prescriber if you can.
Excellent, that's great. So we have received a number of great questions in the Q&A this evening. I'm going to start with something that you did touch on already, but we've received so many questions about it, and it relates to drug interactions. So maybe if you could just emphasize or elaborate around the biggest concerns around drugs that people might be taking for rheumatoid arthritis, but also things like topicals that people might be using for osteoarthritis. If you could just, again, kind of restate the big flags there or things that you want people to remember.
Mhm. So topicals, I find for patients very, very well tolerated. I have not had anybody have interactions. However, I do have patients that are allergic to cannabis, touching it. So always making sure that you do a test dose. In terms of absorbency, again, really well tolerated. In terms of the biologics and any of the medications that people are taking for the rheumatoid, it's really about how you feel. So some patients are taking the chemotherapeutics. When they're taking them, are you taking them once a week? Is it injection? Your dosing is really going to be around how you feel. In terms of interactions, I think it's always something that you need to be cautious with. So in terms of oral medications, I wouldn't be generally taking cannabis or oral medications at the same time when you're taking those medications. So generally it's an hour before or 4 hours after, depending on how the medication works.
Okay. Sorry, go ahead. Did you have more?
No, and I was just going to reiterate again about the, again, my biggest concern really are about the anticoagulants, so for blood thinners. And so as a number of our patients that live with arthritis have comorbidities around heart disease.
Right. We have had a few questions actually with people who are experiencing various kidney diseases. So again, you mentioned this briefly, but that's something also to think about, right?
Sure. Well tolerated in patients. So particularly the issues around kidney disease, again, it's processed in the liver. We do excrete through urine and stool. However, with kidney disease, patients are tolerating it very well, with the exception of medication, with THC in and around blood pressure. So patients, particularly that are on dialysis, peritoneal dialysis or hemodialysis, have some challenges as it relates to regulation of blood pressure. So we know that THC can wreak some havoc on our how our blood pressure moderates. So that can be an issue. So just being cautious about how that medication is being taken and in the dose. But again, very well tolerated. I read a big chapter on nephrology, and the nephrologists are all going, if the patient is using it for symptom control, again, pain, mood, and sleep, and their blood pressure is managed okay, very well tolerated. And one thing that I will bring up as it relates to patients living with diabetes that have kidney disease, the other thing that I do note is drop in blood sugar. So we do know that there is some regulation around how our glucose is managed. So if patients that are on any medications for diabetes, watch for lows, because you may inadvertently start cannabis and realize that it's actually improving your blood glucose, so that you're at the risk for developing a low blood sugar. So just be mindful and monitor. So generally I'll say for patients that aren't actually checking their blood sugar, to start checking again. So Monday, Wednesday, Friday.
So along these same lines, you did briefly mention SSRIs, but we have a few questions here about antidepressants and anything people might be taking for mood disorders. Could you just expand on that a little bit as well?
Sure. So always we're looking at the reason why patients are taking the medication, and so why are they coming to me? If it is in and around medications like SSRIs, SNRIs, atypical medications, it's always around the side effects of medication that they don't want to take that. When we're adding cannabinoids to the picture, we always want to be cautious. So the potential for a medication like an SSRI to become a little bit more effective or even cause serotonin to rise too high and make patients super anxious and sick. That's why it's very important if you're starting those medications to be very cautious about when you're taking it and your dose, and to increase the dose very slowly and gradually with your physician. A lot of the issues around certain medications that cause drowsiness, particularly certain medications for anxiety and depression, it's really about those patients becoming too sedated. So that in the event that that happens, I've had patients, for example, be on something like mirtazapine that they've been using for depression and for sleep, be able to decrease that because they found that they were too groggy in the morning, that the THC and CBD was working very well for them. So that's, again, doses is super important. So incrementally.
Okay. Is there a minimum THC or CBD level that you need for medical cannabis to be effective?
I wish I had a really great answer for that. It's really for CBD, it's about testing that dose, right? And so you can go up to about 1,000 milligrams, depending on your weight, starting at a small amount. I generally will start patients on 5 to 10 milligrams, depending on what they're taking it for, once or twice a day, and then increasing that over time, depending on how they're using it. In terms of THC, there's always anywhere from 20 to 40 milligrams. Most patients will not need in a 24-hour period. They won't need more than that. But again, it's dose dependent. Most patients will say, oh, I can handle that. Well, actually, you don't know if you, unless you try. And so again, dosing in 1 to 2 milligram increments with THC is really the key. And what that dose will end up at, as I say, will it be 100 milligrams in 24 hours or will it be 5? It really is dependent on the patient. And that's really one of the most important things for people to take away, is that as an individual, there's a lot of variety, right?
Mm-hmm. Can you also speak to the main formats of delivery or consumption of medical cannabis, and what would you generally recommend people start with? What kind of format?
Mm-hmm. So for the cannabis naive patient, so somebody that's never used cannabis before, generally I'll recommend ingestibles. If we had puffers for cannabis, I'd be doing that, because what we're looking at is how quickly we want something to work. When we're having pain, we really want something to work quickly. I would love to be able to have an inhaler, but for the most part, patients are ingesting. So that could be in a cannabis oil. It could be in an edible. So you see all kinds of interesting things out there, from gummies to tea to chocolate. We're trying to keep it into the capsule format for medical, but patients are going to choose what they want. So yeah, I think mostly it's ingestion for patients.
Okay. So as we know, people can access recreational cannabis now in Canada. Is the cannabis that people can buy legally there, would it be the same as what they would be obtaining from a physician through the medical stream? And could you speak a little bit to the pros and cons of that?
Sure. So you'll find that the bottles are very small. So they're generally 2/3 the size of what you would get in the medical market. You're going to pay 2 to 4 times more in price, depending on where you are. In Manitoba, you get dinged an extra 6%. So you factor all that in, it can be quite costly. It would be just like going to the beer store or the liquor store to buy. You go in, you buy it. Is the product the same? Yes. They follow the same Health Canada standards. Are there certain things available to the adult use market versus medical? Yes. So you go to the adult use, you buy your cannabis, you take it home and you use it. You have your receipt, you throw it in the garbage. Now, for medical access, for me as a physician, what I would like to happen is that I write a prescription or a medical document. I send it to my neighbor, who is a pharmacist, who will provide that cannabis to a patient, who they providing their access to other drugs for them. But that's not the case. And so unfortunately, I have to now take that medical document, I send it off to a license holder, that is regulated by Health Canada. The patient then has to register as a patient. They then have to go online and order their cannabis from there. They have to pay a shipping charge. They deliver it Canada Post or FedEx or however it comes to them. It's nice. I mean, in the age of, shopping online, it's great. But I think to get your medication that way, I think is challenging for many patients, because the majority of the people that I see are 65 plus. Granted, most of them are pretty savvy, but there's that set of population that this current regime does not work for. So with that, when you do order your cannabis online, you can take your receipt and then put it with all your medical expenses for the year and take it to your accountant or wherever you get your taxes and get a portion of that back. And that's the difference. The other piece is obviously being able to speak with a healthcare provider that can provide education for you. And I know that there's a few of us still clunking around out there providing that service for patients, but I think I'm hopeful that we'll see this integrated more into practice as we move forward.
See, you touched on a few things that we think a lot about at the Arthritis Society around accessing drugs, medical cannabis, just like you would any other medication that you are taking, and also the price and tax pieces. So those are two important things that we at the Arthritis Society are really concerned about and advocating to government. And essentially, if cannabis is being used as a medicine, we think it should be treated like any other medicine that you're taking. So the pricing thing relates to a couple other questions here, though, about generally speaking, you spoke to taxes there at the end of the year, but is it generally covered by people's health insurance plans?
All depends on where you work. So most provincial plans are not covered. First Nations and Inuit Health, not covered. Some health spending packages in insurance companies will support some plans. As we know, Veterans Affairs obviously cover. But I think really the issue is in and around data. And so this is where we get choked all the time. I could be launching studies, randomized control trials, at the drop of a hat. If we had access to the ability to do that, it is so difficult when you apply to get a research license to do this work. I think there's only 2 or 3 license holders out there that have the ability, the special paper to say that they can do this work. So that's the other piece. They push us and say, well, there's not enough data. Well, allow us to do the work. Allow us to have access to cannabis for research. I think it's unconscionable, actually, that we're not allowed to do this when we have a population of people. We have 350,000 medical cannabis patients. We've had over 2,000 people die of toxic drug overdose. We have the ability to use a medicine as another tool in our belt. So I don't know why we need to be so adversarial against cannabis. This is just another tool in our belt. So I hope, we're ready. AGOSA Health is ready to do the work. We are ready to do the data collection. We are ready to be that clinical research site. So calling all cannabis prescribers and researchers out there and patients that want to get their voice out there. Your voice is so important. Your voice is what's driving the work that we do. So I'm ever so thankful for my patients that continue to put their trust in me. And I really would like to get more prescribers out there and more people learning about this important work.
Yeah, and as you touched on in your slides, medical cannabis is different in that, different from other drugs that would have a large RCT first before people are using it. We know that there are so many users out there. So learning from that, real world evidence, what's actually happening is so important.
When we talk about we're building the ship as we cross the ocean, and most people that are in a business say that you just don't know what you're doing. When you talk like, oh, we're just building the ship as we cross the ocean. Well, we have, when you look at Canada, right across Canada, we have an incredible amount of talented researchers we have that are being held back. We as a First Nations organization, we have the ability to drive um, to drive guidelines and clinical research in Canada, globally. We have that here in Canada because of all the great work that's been done. So I hats off to the people that have come before and continue to do the work, because it's still really hard. And we need your support, patients out there. And of course, the Arthritis Society has been a fabulous resource for my patients. I send my patients to you guys all the time for your resources. So I appreciate it.
No, it's amazing. If I could just bridge a little bit, because I know a lot of the research that is happening relates to the different strains and dosing that we talked about earlier. So for people that are starting out or thinking about medical cannabis, what strains should they be considering? Or maybe more importantly, how do they make that decision?
So this is always my big thing. So we talk about strains, and I always will start patients, as I say, on bog standard CBD oil, bog standard, THC CBD, just to get an understanding of where they're going to be at from a milligrams and THC perspective. For patients that are, if we start to be able to tweak that, or if patients are using flower or cannabis flower, or they're interested in the essential oil component of cannabis, which is terpenes, which is another component that we get into, then we start talking about certificate of analyses and what's in the mix, what's in the flower, what's in the oil. Then we can start dialing in. So if patients are looking at, primarily relaxation, you're looking at things that will be heavier in myrcene. You may want something that has linalool when I start talking about terpene profiles. That's very general. When we talk, going back to that slide with all the fingerprints on it, generally for most patients, it's kind of, we'll try this, we'll try something that has this particular profile. It's really challenging. So it is trial and error for many patients. We can very broadly say, try this for pain control and relaxation, so beta-caryophyllene. But are there strain specifics? There are strains specifics or chemovar specifics for patients. Broadly, you can kind of target patients from a cannabinoid, very broad cannabinoid profile, but when we start to dial things in, it's really individual. And that's where working with somebody that has an understanding of particular strains or chemovars or the cannabinoids within the chemovars, it's helpful just to get you started. But your certificate of analyses will always be very helpful for you.
So if someone is thinking about exploring medical cannabis, who should they speak with first? Should they speak with their general practitioner? Should they speak with their rheumatologist? How would somebody start this conversation?
So I think it's C, all of the above. So whoever they're working with as their primary healthcare provider, it should be a conversation. And I know those conversations can be challenging. Over the years, I've had patients see me that said that they've been marched out unceremoniously by their ear out the door because the physician did not want to have a conversation. I think more primary care providers are open to having that conversation. And if the primary care provider is not feeling comfortable with writing a prescription, there's always an ability to write a referral to whichever province you're in. Hopefully there will be a medical cannabis focused clinic, or perhaps a physician that has a specialty in that. Yeah.
Well, that was going to be my next question. What if who you're speaking with, actually our audience's next question, what if people are not receptive to this conversation? So would you recommend people consider homegrown cannabis to treat their symptoms?
So the question is, how many people in Canada make their own beer? Population is about 7%. So when we talk about it from that perspective, it's hard work. And so growing your cannabis as a first timer, deciding that you want to grow your medicine, I probably wouldn't recommend that. However, there are patients that are quite familiar with doing that. And if that's what they want to do, I would support that. I think it's in Canada, well, in Manitoba, we can't grow our 4 plants here. We don't have an adult use ability to do that here. So most patients in Manitoba, if they're growing cannabis, they have to have a medical document to do that. So first time out, no, I probably wouldn't recommend it. If you have a specific strain or chemovar that you're looking for, as you progress, it might be something you may consider from a cost-effective perspective.
Okay. We have a couple questions here about hemp. So could you just explain a little bit about, how that fits into this conversation in terms of a medicinal approach?
Sure. So hemp has, I believe, less than 0.3% of THC. It is primarily CBD, very narrow spectrum of use. However, CBD is CBD is CBD. Coming back to the slide with all the fingerprints on that, I have patients that swear by hemp-derived CBD. It is their primary medication. It works really well for them. I would really love to look at them from a metabolomics perspective and see where they're at. I have patients that on the other spectrum have used hemp-derived CBD, no benefit. So that what we end up doing is then adding in cannabis-derived CBD for a broader spectrum, and they do better. So it really is about where it's derived and whether it works or not for you.
Okay. So going back to this question about where you are obtaining your cannabis for medicinal purposes, is there a difference in quality? If you're growing it at home, if you're getting it from different clinics or being referred by different clinics in the adult market, how does the quality compare?
So all cannabis within the legal regime, medical and adult use, quality we're talking about, right? Yeah, same. If you are to step outside that regimen, so again, there's a lot of lots of stuff that you can buy online. Quality is always a question there, so you never know what's in it. I had a conversation with a patient today about gummies. So this was a 65-year-old lady with just had a knee replacement. Her son bought her some gummies out on the market. And I said, are they from the legal market or are they from the other side? And he goes, from the other side. How many milligrams? So the question really is about, is it truly 10 milligrams? And I'll give you an example. In the toxic drug supply currently, what we worry about for patients using fentanyl out on the street is the fentanyl is not manufactured from a pharmaceutical. So it's kind of put in a bowl, mixed around, little bits are taken and pressed into a pill. Are you going to get a strong pill or are you going to get a weak pill? It's kind of the same in terms of the THC and CBD that you're getting in the unregulated market, hit or miss. So it's in terms of the sophistication and safety. In terms of the cannabis flower that you may buy versus the licit or legal market, so challenging to grow cannabis. I've seen lots of cannabis being grown. I've seen it covered in powdery mildew. I've seen it covered in aphids. People seem to think that's okay. And if you're growing that for yourself and you feel comfortable doing that, okay. As a medical patient who may have, particularly for patients that are immune compromised, would I recommend doing that? No. Would I recommend getting it from a safe supply like the Health Canada regime? Yes, because we know that it will be free from all of those things that we worry about that may get people sick. So quality, I think, is really always the issue, and the sophistication that comes under that system to stick with that.
Maybe I'll close, Dr. Turner. We had the opportunity to chat in a session like this a couple of years ago, so just before the pandemic, really. So I'm wondering, and what has changed or what advances have you seen related to medical cannabis research? Or what do you see different in the patients that you are seeing who are coming to you to talk about medical cannabis? Mm-hmm. What's new?
New? I think really it's patients, I shouldn't say really new, but I think people are really very interested in educating themselves. They're really looking at this as a medication, and that's really evidenced by the amount of people that I have seen since COVID. What I have seen is people using this as a medication to help them manage all of those things that we've seen increase over COVID. So March of 2020, when we're just looking at our data set, we're in the process of reviewing all our data with an AI application to see what's happened over COVID. How are patients using cannabis? What are they using it primarily for? So nothing new in that patients are trying to medicate themselves, but what we're really seeing is a huge spike in patients accessing or wanting that knowledge. So new. I think it's exciting, and I think that bodes well for research going forward. So as we are able to disseminate this knowledge that we're very excited to do, I think what we're looking at is working really towards guidelines, and I think we see them in the distance. I think what's going to help that is the participation of partners that we have, very good partners that we have, particularly in the genomic space. How does this medicine work for people? Why does medication work for some and not for others? So I think we're going to have more answers over the next coming months and years going forward. So I think those are all very exciting things for patients living with arthritis and patients living with chronic lung cancer pain.
That is very exciting, and we will certainly look forward to having you back when you can share the progress and where we are at. And as you say, making sure that the right patients get the right treatment, medical cannabis or otherwise, for their condition.
That's right.
Thank you. So thank you for everything this evening, Dr. Turner. We would like to take a moment to get the audience's feedback on today's presentation. So for those of you on a laptop or desktop computer, you will see poll questions come up on your screen. So click on the response that reflects your thoughts. The first is a question here. Do you think medical cannabis should be taxed the same way as recreational cannabis? And a second, importantly to us, did you find the information in today's webinar helpful to you? We will be sending out an evaluation form when we send out the recording. So if you weren't able to access those poll questions, you will certainly have the opportunity to provide feedback at that time. And we do use those survey results to help shape our Arthritis Talks webinars, and we really appreciate your input. So thank you in advance. Once again, we are grateful to our partners, Canna Farms and Harvest Medical, along with Pfizer, United Way Winnipeg, and our other supporters. We will be concluding the Arthritis Talks portion of this webinar momentarily, and we do encourage you to visit Canna Farms and Harvest Medical's virtual information booth immediately following the webinar, where you will have and see representatives who will be able to answer your questions about medical cannabis and how they might be able to support you. To join the booth, visit arthritis.ca/booth or click on the link in the chat. This concludes Arthritis Talks Medical Cannabis 101. On behalf of all of us at the Arthritis Society, thank you so much for joining us, and stay well.